So I just wanted to give you a little bit of background as to what a clinical nurse specialist is and the standards and sort of the job description. And Sian then is going to go on to talk about holistic needs assessment. So all cancer patients should be allocated a key worker diagnosis. This is mandated, comes down through NICE and in through the Welsh Government to local health boards. There are some issues around funding for clinical nurse specialists, so not all cancer patients in all groups will have a dedicated key worker. In that instance, it would probably fall to the consultant. This name of the key worker needs to be entered onto the cancer database, and that all patients should have a written information card as well. In Aneurin Bevan, we are part of the lymphoma team, and we look after CLL as well. So we've got quite a few thousand patients on our workload, and we cover Abergavenny as well as the Royal Gwent Hospital, and the team move around to see the patients rather than the patients travelling to see us. All our patients are given an information leaflet on the lymphoma team, and they're also given then the contact details and telephone numbers where they can reach Sian and myself in the first instance, and then referral on to the consultants if necessary. So a bit of background for you. So in 2004, so it's quite a long time ago now, all cancer patients, as I said, NICE recommended that all patients have contact with a nurse specialist, and it wasn't until 7 years later that the Welsh Government actually took up the recommendation. So there is always a lag in the funding and the national support for these recommendations. In 2013, one of the cancer patients surveys found that actually only 66% of patients recognised the word key worker and were allocated a clinical nurse specialist to support their care. And in fact, in Aneurin Bevan, we only had 2 clinical nurse specialists covering both the north and the south at that time. So that was a bit of an issue. And at that time, I covered every haematology cancer that was diagnosed in the Royal Gwent Hospital. So things, thankfully, have changed since then. 3 years later, there was some funding put in place by Macmillan to support the uptake of new CNS roles in Aneurin Bevan, and the support for patients actually increased up to 81% across the health board. So we're making massive strides with the help of the third sector funding for these posts. And the most recent survey during a pandemic showed actually 91% of all cancer patients in Aneurin Bevan had contact with a clinical nurse specialist. So I think we are really sort of moving forward. And of course, our aim is 100%, but we're hopefully within the next survey, which should be next year, things will have improved again. So the key worker role, what is it? So we represent the patient and the family at the multidisciplinary meetings. We are an advocate for the patient. And we are there to support you to manage your own care. We like to think we are accessible, responsive, and I know patients have contacted us. Patients with complex needs, we signpost to local services, and Sian's going to touch a bit more about that later, so I won't steal her thunder. And I'll just go on to the job description. So as I say, we've got a wealth of knowledge across, 25 years plus each in haematology. We both trained at master's level, which is part of the job description for a clinical nurse specialist. And so we've spent a long, long time in haematology. We've done advanced communication skills and training, and then we also done clinical examination courses, and we review patients on a one-to-one basis as well. So it's quite a sort of a variation in roles. And again, CNS posts across the health board will differ, and across nations as well, about what that role needs. And you have to sort of make your own job description up in some respect, as to what fits in with your service.
Thank you. So I'm just going to talk about the holistic needs assessment part of all of this. And as John mentioned earlier, both of us have been around for quite a long time, 25 years in haematology and 40 as a nurse. And I think alongside that makes me old. But also I'd like to think experienced, empathetic, supportive, And I think for all of us, cancer is something that affects maybe not just in CLL specifically, but affects a lot of people in, personal ways. And we all need support at different times. And I think today for me has been really good to listen to people's stories, what's affected them, how it's affected them. And I think holistic needs, you'll see often in a lot of the paperwork, it mentions holistic needs, and sometimes people don't really know what that means and what that means for them. But I think it's just about getting the support that's right for the person at that time. And I think we've seen a variety of things today through our active monitoring, through to treatments, and then back to active monitoring, maybe then a different treatment. And along that pathway, we'll see different needs pop up as we go along. So I think for us with holistic needs assessment, we recognise that this needs to be done at varying times, and what you need at the beginning when you're just getting new information about CLL and how it's going to affect your life will be different to how it is when you come to treatment. Maybe that could be a totally different set of needs. And also, I think for those that support us, whether that be friends, families, all of those things impact on your care as well. So we need to look at this holistically, and all those things that hold you up to get through this cancer journey are really important to you at different times and, different things. So the process of holistic needs assessment is about gathering and discussing that information to be able to develop what's right for you at the right time. So we look at the physical things, the emotional support. We've had a lot of this today about physical exercise, but also what you're able to manage to do and not do, and who can help support you in that. The emotional side is, we've talked a lot about the third sector out there, the support through Maggie's, Macmillan, Tenevus, so many things that can help support groups that we run as well. And I think that's something we were talking about over lunch, was our support groups that we run. We did have quite good support groups, a lot of people attending, and I think the pandemic has affected that. We did go online, we tried to keep things together, but we lost a lot of patient support along the way. And I think it's a very different group online than it is when you're face to face. So hopefully we'll soon be able to we've started now bringing our support groups back face to face. So hopefully that will be helpful. And in our support groups, we used to try and get speakers in to talk about different subjects and ask our patients what's helpful for them. Emotional support through our psychologists as well is also important on how to move forward and move on and to cope. Spiritual, mental, social, environmental, there's so many things that impact you as that person trying to cope with this. So as Tracey mentioned earlier, there was a survey done quite recently, and these were the top 10 concerns for patients. And I'm sure as you look at this list, you can probably identify with some or all of these things as you go along. Worry and fear initially about diagnosis, and then also about the active monitoring, and then a time where you might be going for treatment. So there's lots of change along the way. Tiredness, I think a lot of patients have mentioned today about being tired or exhausted, fatigue, all those things, coping with work, with home life, with children, so many different things. Sleep, it's a time when everything starts to go through your mind, and it's about coping with that and being able to shut things off enough to sleep. Pain, eating, obviously other things that are really important to all of you as you go along. And it's knowing that somebody mentioned earlier about having a cough and cold and thinking, oh, what's this now? Is it something different? So it's just about coping with those things as well. So in our health board, part of that survey that we looked to see what was difficult for patients, and some of the top ones that came out for our health board were very similar across. If you can see the different boxes, the green box is actually haematology, and then others were gynae cancers and upper GI cancers and urology cancers, but they were a lot of the same things that came up for patients. And as a health board, we tried to look at what we could do to try and help those things. So we have expanded our welfare benefits team, and we're now able to, make referrals easier and get contact easier. We've obtained a grant which has put a project manager into looking at our psychology team and the support. So now we've got some not just one-to-one psychology, but some living with cancer, some mindfulness, some physical activity sessions as well. So that's really useful. And looking at skills and training packages for the CNSs as well, so that we're up to date and able to give the right information. And hopefully we try to do the best we can with the services that we've got. As Tracey mentioned, we've got a lot of patients, into the thousands of patients. We cover both lymphoma and CLL. And so being able to immediately answer each query is not always feasible, but we hope that both of us are accessible, and we'll always get back to patients. If someone rings within a few days, we'll always try and get back to those patients. And we have an urgent helpline as well for things that can't wait. So I think, just to summarise, I think it's really important that you know who your key worker is, whether that is somebody within the hospital team or whether that's your GP. And it's accessing those at the right time for you as well, because with holistic needs assessments, we can try and offer that at times that we meet you for appointments and so on, but that might be not the time that you're needing that help. And if you're not going to see us for 3 months, if you've got a problem, then it's much better to talk about it. So do you know what symptoms you should be telling your key workers about? So I think it's looking up symptoms that would change your management, or if you're getting symptoms that are new or worsening symptoms, then it's about contacting us so that we can talk through those things. And as you mentioned earlier, so, you mentioned the lumps that are getting bigger, and saw somebody and they said, well, actually, no, that's fine. And there'll be times that happens, but it's good to talk to somebody about it. So do you know how to contact them? Have you asked for a holistic needs assessment? And have you contacted your support groups for help? So I think those are all things really for us and for yourselves to take forward. So hopefully we can provide the support that you need. So that's my talk.